Dr. Leslie Rogers, mental health professional and host of Mental Health Talk. This week's episode of Food for Thought Thursdays with Dr. Rogers, we're continuing a discussion on COVID to provide awareness. You may say, what does COVID have to do with mental health, right? And that's an excellent question. Many of us have been impacted in some way or another by COVID, the pandemic, or the virus itself, or in many different ways. And I thought it would be a good idea to talk about the vaccine. We've experienced, some of us may have experienced like emotional reactions such as toward the pandemic, as low mood, anger, irritability, sadness, loneliness, I've heard, or even physiological symptoms such as anxiety, especially now that we're talking about a virus. I mean, not a virus. Now we're talking about a vaccine that we rarely know anything about, right? So the anxiety. So in many ways, we're impacted. Our mental health is impacted by this pandemic, which is why I asked my friend, Natasha Collia, Dr. Natasha Collia, to come on and talk to us a little bit about the virus and answer questions that she may be able to answer. So let me tell you a little bit about her, and then I'm going to ask her to talk a little bit. So she currently residing in Toronto, Canada. Dr. Natasha Collia is a pediatric emergency room doctor and a simulation educator at the Hospital for Sick Children. In the last year, she has expanded her passion for public education from the institutional level to social media, becoming a public figure for information in common pediatric illnesses, addressing common parental concerns, providing live discussions on hot topics involving other pediatric specialists with the goal of coaching parents on how to be best advocate for their children. And that's an excellent discussion about pediatrics and children and how they're impacted as well, right? So welcome, Dr. Natasha Collia. Thank you so much for coming to speak with me and to talk to us about this anxiety-provoking pandemic, right? This virus, right? This darn virus.
You summed it up pretty well.
Yeah.
But thank you for having me. I have to say this has been great because we had an opportunity to chat where you came on and spoke on my Instagram Live series about mental health. And it was so impactful and so great for everyone, because I find that we're at a time right now where, we're experiencing this collective trauma. And first, I mean, let's say it's probably been about a year. Mm-hmm. We've hit just about a year now where it started to impact all of us at a greater level. And, at that time it was just a virus. I remember times where people was like, it's just a virus, and it's just like the flu, and it expanded, it grew, it took over, it became deadly. Yeah. And with that came everything you just said. There was lots of fear, there's lots of anxiety, there's a lot of frustrations and angers, lots of lives were affected in many different ways. And then after people got into this idea of this new virus, then what things can we do to protect ourselves and protect our loved ones and be part of the solution and not part of the problem? Then a vaccine came around, and where someone like myself who's in the healthcare land hears vaccine and knows about all the work that's gone behind this, and how quickly everyone worked despite it not actually being that quick, but what people see or subjectively see is quick. Right. It got me really excited and really happy, and I think it did to a lot of the medical world. And we realized it also brought on even more anxiety and more questions and more fears. And I think part of that was the way it was brought out as this is a solution. Mm-hmm. And there's a lot of education around it that people were trying to do around this vaccine and make people aware of it more. But the need was there, and it needed to be sped up in terms of getting it out to people, that perhaps maybe the foundation of education and understanding around the vaccine may have kind of fallen to the wayside, and just, here's a vaccine. This is a solution, in a good way. And, you know, we live in an age where media and information is so accessible at our fingertips, but so is the ability to take that information and manipulate it in a way that it puts more fear into people. And I think that's kind of where we're at today. And that's why I want to say thank you for bringing me on and talking about this, because there's nothing more important than breaking down the facts and making it very clear for people what's out there and what's true and what isn't, to help potentially bring down the anxiety to make better educated decisions.
Yeah, absolutely. And I believe that as a nation, we're reactive as opposed to being proactive. We're reactive. And, you know, it caught everyone off guard, right? And so when you think about, you know, we want to fix things as a nation. And to fix things, right, is to, you know, conduct research and come up with a vaccine or something that we can lower risk. It's interesting that you talked about, you know, being able to, you know, as a medical professional, you know, talking about the anxiety that not only professionals feels. You know, I was in the room with you, the physicians, Dr. Collia has a talk web series called Physicians in Rooms, right?
Living rooms, yeah.
Physicians in living rooms, and I had an opportunity to speak on that, and I got, you know, firsthand eye of how a lot of us are impacted, you know, by anxiety and other things. Even physicians behind the scene, you know, are struggling with anxiety and struggling with this pandemic, and you know, the work that they do. So I applaud you for that.
Thank you.
Yeah.
Thank you.
So when we talk about, you know, COVID, let me ask you a quick questions really quick. With COVID, I will disclose. So my mother was recently diagnosed with COVID. It was a really frightening experience. She's recovering now, but it was really frightening. Let me ask you, with respect to COVID, how long does it take from a positive result for you to have a negative result? I know, is it 30 days or can it take up to 3 months or?
That's a great question. And I think the reason why this is a great question is because it's kind of multifactorial. Okay. So the point of the positive COVID test, right? The one that everyone's been talking about. First, it was the nasal one. Now we've got a throat swab and mouth swab just for saliva.
Oh, I didn't know.
Yeah. So initially everything was always nasal. But there was a young man out of Harvard, if I'm not mistaken, who created something just as good and test worthy that can, you know, test positive, and it requires, you can do throat and just saliva. And so the first question is, you know, the test that you're getting, are you getting the test because you had symptoms and, or you didn't have symptoms, or you had COVID? Because it does truly make a difference, right? Because if you've had COVID, you normally never get tested. You know, other than the first time, you never really get tested again. Okay, you know you had it. You know that usually on average a virus is about 7 to 14 days. You know that you're typically most infective the day before you start hitting symptoms, and you're most infective in the first few days of your own symptoms. And so typically no one really follows up with a negative COVID test, because once you've had a virus, one, you've built your body has learned to build an immunity to that virus on its own, without a vaccine, without anything else. And if you're lucky, because as we've learned, COVID doesn't pick people, and it doesn't have sense. It doesn't, you know, we know who's high risk, so we're very careful about those groups. But even then, like you were explaining with your mom, you know, it didn't happen the way you thought it was going to happen, you know, and there's young people who get really sick with it and we don't know why. So typically, do we test again once you've had it? No. The one thing I say about testing, though, is that we probably should look at it in a way of, when do you test? Because a lot of times, if you're concerned that you've come into contact with someone who has or has COVID, because if you had it weeks ago and you come in contact with them, you shouldn't be worrying about taking the test. But if you find out someone that you just came into contact with was positive for COVID, there is a period of time that once you've been in contact with someone, that you potentially could get a test done and it's negative. Because for a test to be positive, you need to mount a certain response in your body and enough virus in your body for that test to be positive. So, you know, that in itself could make people have false reassurance that they don't have it if they do the test too early.
Right, and that's
So,
a good thing you say, because I want you to continue with that note, but we have heard that if you're exposed, like my mother was tested positive, so I was exposed. I went and got tested the next day, right? So I was
right.
told to come back in a few days and retest.
Yeah, and I think that's great that they're saying that, because what we're trying to reduce is the false negative,
Right.
right? So the ones that are telling you they don't have COVID,
Right.
but it's falsely negative. And so what we've learned is that just because you've tested negative doesn't mean you're not harboring the virus.
Mhm.
And usually, like we're saying, the average onset of symptoms is about 5 days post your exposure,
Mhm.
and your peak infectious is 2 days before.
So how long should you actually wait? Would you recommend waiting after exposure?
We usually say 3 to 4 days.
Okay.
Is typically what we would say, but you can even go up to 5 days without harboring enough virus in your system.
Mm-hmm.
So don't always, one thing we just say is don't try to get tested right away. Unless, let's say, you've been living with that person and they've been in the same household with you. Now you're in close quarters with someone. There's a higher chance that you also are harboring the virus without potentially having symptoms. But this is if you've come in contact with someone who's not currently like in your bubble 24/7,
Yeah.
and you find out they have COVID, don't get tested right away to give yourself some false reassurance. If you want to do the smart thing about increasing the chances of having a positive that is a true positive, wait a few days before you do that. Now, with that being said, just like any time that you get a virus in your system or the vaccine in your system that's helping you mount that response, you can go, if I'm not mistaken, up to 3 months with still having antibodies in your system that could give you a false positive test.
Mm-hmm.
So you can go up to 3 months. 2 to 3 months is the longest I've heard from our infectious disease doctors, that if you get tested and you've already had COVID, you can still be positive with a test, which doesn't mean you got re-inoculated. Remember at the beginning, everyone kept talking about like you can get re-inoculated with COVID.
Mm-hmm.
It was because people were taking the repeat test too soon.
Okay. Mm-hmm. Okay. And so then that comes to my next question. If the test can remain in your body for 3 months, does that mean that you're still contagious?
That's a great question. So typically, like I said, you're most contagious up until about day 10 of illness.
Okay.
After that, your symptoms that you're feeling, the majority of them is your body's immune response still fighting off the virus. So this is a great question because I think it helps clarify for people.
Yeah.
To be contagious, you need to have a certain level of viral load, which means the virus got into your system, used your own cells to just kind of harbor itself and recreate itself. Okay. And so I think it's about, once it's gotten to about 50 to 60% load, then you are starting to be infectious.
Mm-hmm.
Okay. Don't quote me on the numbers because they do kind of vary depending on, what virus we're talking about. And again, I'm not an immunologist. I'm not a infectious disease doctor, but we're all educated on this because we need to know how to fight it. Mm-hmm. And so that's when people hear the word viral load, I think, and infectivity, I don't think people always know what that means. So viral load is just how much of the body in your body, like what percentage is in your body and replicating to be strong enough to produce symptoms that can infect someone else. Okay. And that's when you are a infective person. So your infectivity is how long that goes for. And usually up until 10 days of illness, you can still infect other people.
That's why they're saying quarantine for 10 to 15 days.
Yeah.
Exactly.
They always try to be safe, that extra 4 days.
Exactly. So quarantine, if you're exposed, quarantine, get that test done 3 to 4 days after to prevent a false negative. Mm-hmm. Exactly. So, let's go back and talk about at-risk populations, so now they're starting to say that there may be a genetic component, right? Statistically, my mother should have died from this virus, right? And she's recovering. So have you heard or have them been talk about a possible genetic component? Now you're seeing children are dying or whole families, are dying. Families.
So I think that's a great question. I think that also goes back to the concept of the research is still coming in. Okay. Mm-hmm. Because all we've done is been able to see certain populations over a year, but I still think we need more data. Yeah. And that requires a lot more of the geneticists and the biologists and all them to kind of to pipe in about that. I have seen, and I just recently today saw on the CDC website, talking about genetic components. However, with that being said, if you think about all the adults who are more at risk, so diabetes, Down syndrome, cancer, chronic kidney illness, immunocompromised, so weak immune systems, COPD, cardiomyopathy, so where your heart is a little weaker, severe obesity, sickle cell disease. Those are actually all have, some of them, majority of them have a genetic tie to it. So if you really break down the really concerning populations, and that includes even in the pediatric population, children less than 1 year are high risk in general, because their immune systems are still being built. But then the ones that are even higher risk are the ones that were born with congenital defects or born with congenital illnesses. So all of that is genetics. The few things that are not genetics or can be partially genetics and not genetics related, one is obesity. So some of it is genetics if it's part of a genetic disorder or genetic illness. But some of it is not, right? We all know that obesity is I lived in the US, this for 15 years, and Ohio was a really obese state, and that's not to not have facts, but it is. Texas being another one, right? So that does exist. Smoking puts you at risk in general. That's not genetics. Pregnancy, pregnant women, higher risk. And so those are not genetic disorders, but there are parts, that make your immune system a little bit weaker or more susceptible. So I think in general, we just need to be very, very sensitive to the little bit older age population, the people with either genetics or illnesses, chronic illnesses that weaken their immune system. Or what people forget is it's not just immune system. COVID has been known to affect the lungs. COVID has been known to affect the liver, the kidneys, the brain, the blood vessels. So if you have anything, heart, if you have anything that already affects the organ, you put another system, you put another kind of insult in there that's a severe illness. Yeah, of course it's going to get worse. And potentially that's, the reason why you get worse than some people do.
But that does not mean that people with a history of disorders or medical conditions are going to succumb to this virus.
That's correct.
Does not mean that.
That is absolutely correct.
They're just at higher risk.
Yeah. The one thing I will say, though, is that most people don't realize is that one thing that we are seeing in the pediatric population more than anything else is that, so for anyone in the room that, may be a parent, is children with this thing called MIS-C. It's called Multisystem Inflammatory Syndrome in children. And so this was something that was seen first in New York about maybe 6 or 7 months after COVID started. And initially they believed it was a late response in the pediatric population. So kids who either had COVID and knew or didn't know they had COVID. So because we all know children are a little bit more asymptomatic.
Yeah.
And then they would present months later with this multi-system, full head to toe, lots of different organ involvement, and they were just sick. Now we're realizing, being in the pediatric population, that these kids are presenting that way, but it doesn't always mean that you came in contact with someone with COVID. So we're still learning a little bit more as to why this all of a sudden has transpired.
Yeah. And again, this is a new disorder. The vaccines are new. We're learning as we go. Let's take a question really quick about COVID.
Yeah.
So Maurice, are asymptomatic able to assist in COVID recovery of those that critically ill from the virus, and the complications are only the previous positive people antibodies the only assistant? You get that?
Yeah. So I guess my question about this question is, is the question asking, so let's clarify, is the question asking, are asymptomatic, meaning they've already had COVID and now they want to help others who are currently critically ill from COVID?
So asymptomatic to me means that you may not be displaying all of the COVID symptoms. You
so
may
the
have.
Question makes sense to me, no. So is it asymptomatic as in you had COVID, now you don't have symptoms and you've already built a natural immune response? Or is it, because technically then we're all asymptomatic. because we don't know. And unless you know that you've been very good and you've social distanced and you've kept that mask on and you know 100% sure that you do not have COVID, then we're all typically asymptomatic. Now, if we mean asymptomatic, like you know you have COVID and you just don't have outward symptoms, then you shouldn't be around anyone. Yeah, if you know you have COVID and you have no symptoms, you're still harboring the virus. The virus is still in you. The virus load is still increasing. It's still going to work itself through you like it does anyone else. You are just one of the lucky people that it does not affect you the way it may affect other people. But you are still potentially someone that can give it to someone else. Yes.
Great question.
That's a fantastic question.
Mm-hmm. Okay, so let's move on to the vaccine, right? Everyone is anxious about the vaccine. Are we going to have the vaccine yearly, or how often are we going to be? Is it going to be mandated? And so first, let's start with Natasha. Can you tell us about the vaccines? Aren't there two, right? Two vaccines?
So that's a great question. There's actually 2 currently approved, and there is another. So Pfizer and Moderna are currently the ones that are approved and being handed out to everyone. Janssen, Novavax, AstraZeneca. So Janssen is from Johnson & Johnson, or is it Novavax? And then, so there's a few other that are currently in the process of being created, but have not been approved to be distributed.
Are they here in the US other than Pfizer and Moderna?
I don't think so. I think those are other ones that are currently being looked at and approved in Canada. So right now, of the 2 vaccines, Pfizer and Moderna are the 2 that everyone hears about, everyone knows about. The big thing is that they're almost exactly identical. Okay. Cause that's always the next question.
Yeah, what's the difference?
Yeah. Everyone's like, what's the difference? They were approved 23 days apart, same month last year. You both have, like for both of them, you still have to take 2 doses, anywhere from 21 days to 42 days apart. Okay. And why, I'm going to just quickly answer that question, is because remember how we talked about immune response? Once the vaccine's in your system, the vaccine doesn't stay in your system forever. Your body breaks it down, throws it out the door after it's built its own immune response. And to enhance that reaction of your body building the immune response, you need a second dose. And what people forget, and I'm going to say, everyone's like, why do you need a second dose? What people forget is back in the day, when you got your very first flu shot, you got 2. You don't just get 1. Even when you were 6 years old and you never received a flu shot before, you always had to get 1 followed by a second so that your body could build that initial response. After that, the goal was always with the flu shot was to give 1. And they did. After that, yearly, it's 1 shot every year. So that's pretty much like similar between the 2. Pfizer, that came out first, is the one that everyone kept talking about that needs the ultra cold storage. That everyone's like, well, that's a problem because if we don't store it under cold, then we can lose. And you've probably heard a lot of stories of vaccines being thrown out because if it's not ultra cold, you can't maintain it. Moderna only requires routine cold storage. So there's a little bonus for Moderna, but not for Pfizer. Pfizer is actually a little bit less expensive than Moderna. And the efficacy, so effective rate. Let's talk about that really briefly before we go into what's underlying the vaccine. This is the part I get questions about all the time. Oh my gosh, the vaccine the virus survival rate is 99%.
Wow.
Okay. That's what they say, right? Everyone keeps saying that this is why do we need a vaccine? Survival rate and efficacy of a vaccine are 2 different things. What people forget is that 99% survival rate also includes a large percentage of people that spent time in ICUs, that now have long-term critical illness second to this virus, that may be living with a feeding tube, intubation, airway support, heart support, renal failure, so kidney failure. this is what people forget. So just because, and this is where we talk about misinformation. People put numbers out there, but forget to explain what the numbers mean. So 99% survival rate sounds fantastic until you break it down that 99% survival rate also doesn't mean that 99% of those people are living a good quality of life and potentially could die in the next year or two. So we'll say that. So when we talk about efficacy of a vaccine, we're talking about how effective a vaccine is to reduce the potential of severe symptoms or death. That doesn't mean you're 100%, 100% you're not going to get it. That's what vaccines do. Okay?
And nothing is 100%. Even the flu vaccine is not 100. You still can, contract the flu.
And this is what I want people to understand, is that before we get into talking about, questions, we need to understand what this means. So vaccines, I think there's always been a misconception that once you're vaccinated, there's no chance ever that you'll contract a bacteria or a virus, because that's what we build vaccines for deadly ones, right? Really deadly ones. Polio, diphtheria, tetanus. Those are the big ones, okay? So once you get the virus, the goal is to reduce, if you ever come in contact with this virus, so once you get the vaccine, is to reduce the potential of you developing moderate to severe symptoms or death, okay? Some people get it and never contract it. Some people still get the vaccine and still may contract it. But again, we're trying to make quality of life better. Right. With that being said, Pfizer is 1% better than Moderna. So in the reality of big things, it's really not that different between the two.
Yeah.
So when we're talking about the two.
Yeah. So when we talk about the differences in the vaccines and the side effects, right? You hear differences between some people get serious side effects like headaches, vomiting, etc. I've heard that Pfizer is worse than Moderna, or Moderna is better than Pfizer. So when you talk about side effects and things of that sort, what are side effects of these vaccines?
I love that you asked about this, because this is one of my favorite questions that I like to talk to families.
Which one? Yeah.
So I think the question should become more worded as, why is everyone so worried about side effects? And I'll say this, because this is what I tell everyone I deal with. The minute you get up in the morning, to the minute you put that coffee in your mouth or that tea, to the minute that you eat that cookie or that piece of bread, to the end of the day when you try that apple or that salad, I want everyone to understand that every day when you do something new or introduce your body to something new, there is a potential for side effects. Tylenol, Advil, there is potential for side effects.
Yeah, I'm guilty of that. I said I'm guilty of that too, because when I'm talking about medication, I always think about, well, what are the potential side effects? How am I going to feel after taking this medication?
Right. So I think what happens is sometimes we are our own worst enemies. And what we've done is we've created this negativity around the word side effects. I'll tell you, there's a line I draw as well. To me, side effects are concerning when the side effects debilitate me or the person who's consumed or received a vaccine to the point that it's a long-term potential debilitant, right? So like a long-term effect. What I mean by that is what we talk about and what you've all heard is anaphylaxis. Anaphylaxis is life-threatening. That means your body has just had a severe reaction to the point where you need life-saving medication and you potentially need an ER every single time, okay? So that to me is when I'm thinking of side effects, I think of anaphylaxis. Right. Anyone can develop a side effect from a vaccine, not just this one. Every vaccine you've ever received, you can get chills, body aches, headaches, sore throat, tired, bellyache, diarrhea. Oh, what? It sounds like even me when I'm gluten and I eat some gluten, that probably sounds like a regular night for me. Okay? That's exactly what it is. And so based on kind of the group of people I've been with, all of us, again, thankfully as frontliners, we have been vaccinated. I would say about 20% of us did not get any side effects.
I haven't either. And I've received my second vaccination and I haven't had any side effects. But, the question, and I'll go back to that really quickly because I know a lot of people are concerned about this. Even I was concerned before I was vaccinated, are the long-term effects. right? Long term. I take a new vaccine now, then how is that going to impact my life going forward? Or how am I going to, is it going to, am I going to end up with cancer? I've been asked. Or,
so that's a great question.
Yeah.
You want to know why? Because when you think about it, the short-term side effects are there and they're minimal. The people who have severe anaphylaxis, you just got to watch yourself every single time you take another vaccine, but it does not mean you're going to have the same response. My coworker who's a doctor is anaphylactic to everything, took the vaccine, never had a reaction. And I think it also has to do with what the vaccine is composed of as well, right? So when we talk, sorry?
I said that was one of the questions about the vaccine they made.
So I think before I answer the question about long-term side effects, what I think we should do is potentially talk about what this mRNA vaccine is. Because to understand what a long-term side effects means is you need to understand how it affects your cells and how it affects your body. And I'm guessing someone in the group may have a question about mRNA. So I'm waiting for it. Does anyone have a question? Because that's true. It's a common question.
Yeah.
Do you see any questions?
Explain it.
So I don't know how many men and women we have division in this group, but I used to describe this because I used to talk to a mom group and I always say, try to make this as relatable as possible. Okay. When you talk about things that confuse people. So mRNA, I'm going to say this, you need to understand what a cell is like. So you've got your home. I'm going to use it as your home. Okay. Or we're going to say you as a woman, you as the queen of your home, or any man that may be in this group as the king of your home. You choose one room in your home, and that's the room you stay in at all times. That is your throne. That is the place where you control everything that goes on in the rest of your house, outside of your house. You stay in that room. Those four walls around that one room, so let's just say it's your bedroom. Those four walls of your bedroom is a protective wall around you. You are the blueprint of how everything works. You are the messenger of how everything works. You are the reason why everything works. Okay. I want everyone to picture that's what the cells of your body are like. Okay. Those four walls, things can't get in and out of it very easily. So what about the person who lives with you in your home? Let's say we have a cohabitant in your home and now they can travel all over the house. They're your workhorse. Okay. And there's a reason why I want to be able to explain this way. They're your workhorse. They can float around the room inside the house, but cannot come in to your bedroom. And somehow you two need to communicate. And the reason why is because you're the blueprint of this whole home functioning. You need the workhorse to do things for you, right? You need them to cook a meal. You need them to fetch you a glass of water. You need to clean the garage, right? How do you communicate? Because he or she cannot come into your room. You can't leave the room because you are so important. You're protected. Okay. So you have to find a way to communicate. So what do? You create a message, pull out that phone, nice little text message, and you send that message out of your room via phone. That message floats into cyberspace, which is the rest of your house, and ends up in your partner's phone. What happens at that time? Either they choose to read it and ignore it. Either they read it and forget about it, or they read it and do exactly what you asked them to do. That message that was sent out. It doesn't come in. It was sent out. It's a one-way message, right? They can't alter the message that was just sent out. They can't, change what you said. Now they may misinterpret it. That happens sometimes, but they can't change what you asked them to do. And once you've asked them to do that, they do it. That's what mRNA is. It's the center of the cell sending messages in different cryptic ways to the workhorses for the rest of the house to be done. So whatever that message says, the workhorses, proteins in your cell have to do. Okay. What I want to say is the minute that message is read and whatever is done, it disappears. It doesn't exist anymore. It's broken down. It goes into whatever hyperspace. So that is what this vaccine is, everyone. We were able to take information from the virus, replicate that message, protect it, and now put it into our own cells to help those workers receive a message like that to develop a protective mechanism against this virus.
Right.
Remember, it doesn't go in the nucleus, which everyone's probably heard. It doesn't change your DNA.
Yeah.
You're protected, right? And after that message has been read, there are cells in your own, there's little enzymes in your cell that break that message down and toss it like it's garbage after that. So it doesn't linger. So with that being said, if the vaccine is an mRNA and it doesn't go into your blueprint, can it affect your genetics? No, it doesn't touch you, right? It only provides a message. 2, think about how much quicker your body learns to respond to that message. Now, imagine every time you want a dinner delivered to your door, you don't even have to send a message. They just know, oh, it's dinner time. Time starts. So it's the same kind of response, right? With time, your body doesn't need to go through that long process of decoding that message. Now it just knows. It knows how to fight because it knows and recognizes the virus. 3, once it's done that, the vaccine sits in your body, as we know, to help you build enough of a response. But we also know the mRNA is broken down immediately after it's been read. So it doesn't linger long enough to have long-term effects. What it's done is it's taught the cell to do a job. So when people ask about, can I be infertile? Can I have genetic malformations? Can my baby, if I'm pregnant, get it, have genetic malformations? What if I have physical long-term effects? If it doesn't touch your DNA, it can't affect you as a human in terms of your genetic code. And we also know that we've seen how the human body works and how vaccines have worked over the years.
Yeah.
There's never been long-term negative effects from a vaccine prior because it doesn't stay in your body long enough to have a direct effect. What it does is it teaches your body how to be stronger against something. And that's what I think people don't explain enough for people to understand, which is why your question comes up all the time.
Yeah, and that was such an excellent analogy, It helped me understand a little bit more about the functions of the vaccine. Again, the concern, that many of us had was, that long-term component, if it's, especially when you're talking about doing modifications, molecular modifications, how is that going to impact, when we go forward, are we going to end up with cancer? Are they going to, and then the vaccine is so new. It seemed like it was a quick process, quick.
We can talk about that.
Right. And, and so when you talk about the vaccine and talk about, how new is it and how quickly it was developed, is it harmful, by getting the vaccines? We talk about other vaccines like flu vaccines, etc. But this is everything is so novel about this.
Let's talk a little bit about that because I think there's a lot of anxiety.
Yes.
Let's put it in perspective. COVID-19 was first recognized in China in November of 2019, right? December 2019. The average time frame it takes for a vaccine to be developed is anywhere from 16 to 18 months. That's the average vaccine. Now, to remember that the average vaccine is a little different because the average vaccine requires researchers to do a lot of steps. Okay, let me talk about those steps. 1, you're usually one group of researchers with one company with minimal money, which is why it always takes so long. 3, so that's 1 and 2. 3, you need a population of people with the disease and population of people without the disease to be able to test.
Right.
Usually when they're creating vaccines, it's not during a pandemic, which means you don't have access. 4, the other thing you got to think about is mRNA was already something that had been being developed for over a decade. It was already in development for multiple other viruses, but never came to effect because it was never a pandemic. What happens in the pandemic is everything's escalated, right? So when December hit and COVID-19 actually showed its face, researchers around the world started to come together now and work together with funding from everywhere. So now we're not just talking about one group, we're talking about lots of funding being thrown into this. So many people, lots of funding. mRNA is easier to make because once we already had, remember, we had SARS. SARS and coronavirus, okay, are from a very similar family. So we already had the blueprint from 7, 8 years ago, almost 10 years ago. So we had the blueprint. So we weren't starting
as we thought it was.
Right. So there's been things that have been going on for so long, but no one talks about them, right? And so everyone's under the impression that all of a sudden one day it created, one day it's discovered, all of a sudden there's a vaccine. Meanwhile, when you think about it, from December when it started to hit to 3-4 months ago, the first vaccine, that's not a short period of time. Yet we had double the money, double the numbers, double the people, and we had a population who were willing to be part of a trial, which usually to get people to be part of a trial for any vaccine, it's hard to do. You got to find the right people. Right. And then it needed to go through scrutiny, like next line of approval to be able to see the vaccine was effective enough.
Yeah.
And so what people don't realize, it's a perspective of like it happened really quickly, but there was so much more that went into that. And so at the end of the day, it may have been shortened time-wise by maybe 4 or 5 months, but it's because we had all the resources to do it already.
Yeah. Again, and this is a result of us not seeing what's behind the scenes, right?
Correct.
Yeah, exactly. So, you know, we talk about who would be an appropriate candidate for the vaccine. For instance, my mom, who was diagnosed with COVID, I disclosed that earlier, she's on blood thinners. So I was told that she is not a good candidate for the vaccine. So should people get and I'm actually glad that I asked her doctor about this before I gave her the vaccine.
I was about to say, the most recent information everywhere is saying that there's about 1 million people with that are on blood thinners every day, and it does not exclude them from getting the vaccine.
That's what I was told. I was told because she was on blood thinners, you know, she wouldn't be a good candidate. So now you're here. Who would be a good candidate if people have pre-existing conditions, medical conditions? Should they seek medical advice before they get the vaccine?
I think that's a fantastic question, because I think part of the anxiety is knowing, are you going to be safe? Right? Because you don't know. The unknown is very scary. So I'm going to say this, like I say with, you know, the flu vaccine and any vaccine, the flu especially, because the flu can be pretty deadly every year. Again, I'm not saying COVID is the flu. I'm just saying from a vaccine standpoint, with getting the yearly flu vaccine, we tell the most elderly, the most immunocompromised, and the people who have no large contraindications. So like even young children eventually, because now we have kids in trials. So this is fantastic for our world over here. But you are more susceptible. If you are deemed as more susceptible, that if you get the virus, the effect it's going to have on you is going to be a more severe to potentially deadly, you should be eligible for the vaccine. With that being said, I don't know everyone's background. I don't know everyone's health history. That is a discussion with you and your healthcare provider to discuss, because what we found with this is, because with trials, you cannot, it's not even ethical to put children in trials. So now that we know how it works, now we can. It's not ethical to put pregnant women in trials, because everyone was upset about like why pregnant women and children were not included, because it's not ethical. Now that we know how things are working, the American College of Obstetrics and Gynecologists, 100%. If you're pregnant, you're at high risk, you should be getting it. There's nothing that's saying that you shouldn't be getting it, right?
Right. And there's no evidence to suggest that it would be harmful to the fetus.
No, because remember, like we explained, the minute so here's another thing. The minute you inject that vaccine, right? First of all, you lose a little bit in the local area. Automatically broken down. You get maybe some local tenderness, it would be. But the minute that it's in your cells, remember how I told you, the minute it's processed that information, it's discarded. So it's not going out into your body and providing DNA of the virus, so that the virus is infecting your organs. What it's doing is teaching your body to mount a response in the future if that virus, you come in contact with it. So imagine a pregnant woman, it's literally only going to affect the woman, and that rest of that mRNA and virus is tossed out. So nothing gets to the point of having to cross the placental border. What they are seeing, though, is that, so there were, what most people don't know is the original trial, about 42 or 46, don't quote me which exactly, one of the two, women didn't know after they got the vaccine, they got pregnant. and they've already delivered their babies. And they went back and they found that a good percentage of them have provided some immunity to their baby.
Wow. Okay.
So good news for those that were worried about pregnancy, because remember, moms give babies antibodies through breast milk, you know, and they give them like that immunity. So that's what they're seeing more and more of now.
Right. Excellent. Excellent. We're going to take questions in just a second. But, you know, about a few weeks ago, there was a news article that came out about a woman in Virginia who took the vaccine and then died after she took the vaccine. After I went back and read the article, I realized that she had COVID before she took the vaccine, I think. And if anyone read that article, you can correct me. So one of the questions was, you know, have anyone, you know, had a strong reaction from the vaccine that it resulted in death?
So I can tell you right now, based on the Canadian statistics, we've had this was just up to last week. So some of them are behind in numbers, but we have a reporting system just like everyone else does. Up until last week, 70,000 patients were vaccinated. No deaths, no hospitalizations of any of those people that received the vaccine, because we're monitoring, right? You know who's got it, you know, kind of you follow.
Is there anything inside the vaccine that could cause an allergic reaction?
Sorry?
Is there anything inside of the vaccine that can result in an allergic reaction possible?
So any vaccine, there's always a potential for an allergic reaction. Right now, what we know, the mRNA vaccine for COVID, for Pfizer and Moderna, were created the exact same way, where there's no preservatives, okay, whatsoever. There's only a protective shell that's created, and I love this because I joke with everyone about it. It's created with PEG, which is polyethylene glycol. Now, if any of you in the group right now know what PEG is and where you can find it, it's actually found in, have you ever heard of Restorelax?
I have not.
Has anyone heard of Restorelax in this group? Restorelax, also known as the powder that you put in water to help you stop yourself from being constipated.
Oh, okay.
That's pretty much it. That is pretty much the only other ingredient that covers this mRNA to protect it enough so they can get to your proteins, and the proteins can read that message and do its job.
Right.
So it could potentially be a very new way of protecting vaccines in the future without having any of those little small preservatives that we know that potentially lead to anaphylaxis. But in terms of death, there have been absolutely no deaths from this vaccine or long-term, like any effects that we've seen long-term. And by long-term, we mean 6 weeks after.
Right.
So far we're good.
And another question I want to get out before we start taking your questions, is I think this is really important. My concern is that when people become vaccinated, you know, they're going to assume that, okay, since I'm vaccinated, you know, I don't need to wear a mask or protect myself. And I will say that because I was in a restaurant the other day and this guy was in there without a mask, and I asked him where his mask was, and he said, I just received my second vaccine, you know, and I said, nope, go to your car and get your mask, right? So, you know, erroneously thinking that because I received this vaccination, I'm safe and I no longer have to protect myself. What do you have to say about that?
I have a lot of things I can say about that, because I think that's where we're going to go downhill if we're not conscientious. Yeah. And again, I'm not here to preach and tell you what you should all do. But at the end of the day, we have a vaccine that's proven now to work. It's been around for a while. There's no severe negative side effects. And the only way, so this is what I want people to be very conscientious about. The majority of this world doesn't know what it means to go through a pandemic. If you're lucky, maybe you have a grandparent who's still alive that went through the Spanish flu. I did up until last year. So last year, over a year ago. And I used to hear the stories, and I used to hear about how they got through it. And it's because people came together and realized that the only way to protect themselves and to keep going forward and not have more people die is to do what was recommended. Okay. And by then, you know how many people died. It was awful. So what I'm going to tell people is this: before you get your first vaccine, up until 14 days after your vaccine, you can still get COVID. Remember, until your body has not mounted its own response. And again, we all know that the vaccine takes some time to mount that response. You can, so I think, let me remember exactly. I think it was 10 to 12 days, perhaps. 12 days after the first vaccine, you've got about 95% efficacy. So you can get COVID up until 10 days after your vaccine. Okay. But after that, your vaccine efficacy, because your body's never seen it before, drops again, which is why they recommend a second dose to boost that efficacy. So you can still get COVID when your boost has not been given to you yet, or right after your boost, or between. What people forget is that this isn't going to be able to be like determined and fixed right away.
Right.
We need to do what's important by vaccination. And if you choose not to get vaccinated, mask wearing, social distancing, washing your hands, not coughing. If you're sick in any way, shape, or form, please don't go outside. And wearing your masks is not this.
Right.
Okay? Wearing your masks is this. And there's no mask that's better than another mask. Let me just put that out there as well. If you're protecting yourself and covering your mouth and protecting others at the same time, because it's not just about yourself, it's about others. If you're asymptomatic, you don't realize it. The only time that the type of mask that matters is it depends if you're in contact with people who have COVID and you're managing them. So you're in their face 24/7, you're, treating them. So like healthcare workers, personal health, like home workers, personal health nurses. You need to have a very good mask. And that's what I mean by that is like a surgical mask, because you are literally in other people's faces for longer than 15 to 20 minutes at a time.
Right.
So that's why when people ask me about like, should I go out and buy surgical masks?
Yeah. Should you double up? Do you recommend doubling up on mask?
The only time I double up on a mask is if I'm intubating or doing a procedure that requires suctioning and there's going to be like droplets coming out at me. That's the only time I double up, because the reality is that there's no proof that says doubling up is going to make it any better or any worse.
Yeah.
But it's about face shields help because you're covering your eyes and it's the double protection over your eyes and any of the open surfaces. Imagine the moment that your mask slips off your nose, your face shield does help with that.
Excellent. Okay. So we're going to take questions, and oh my gosh, this was such an excellent discussion. A lot of information. So is she aware of the issue with the woman? We just talked about that. The woman in Virginia. I'm a little bit familiar with the story. I went back and read the article and realized, I think, and you can clarify this, Miss Sherlon, I hope I'm pronouncing your name correctly. Go back and clarify. I think she was already exposed to COVID when she had the vaccine.
I just read the news about that too. It does say that the autopsy showed that this had nothing to do with the vaccine.
Yeah. Let's see. But last week, it was in the news that WHO said after getting your second vaccine, you don't need to wear a mask. This is very misleading. I do wear 2 masks when I'm out in public.
I like it. Is that Margaret?
Margaret, yes. Margaret.
So the WHO will always so I don't want to say that they're contradicting. I don't want to say that they're wrong. But like everyone else, the WHO doesn't know what the potential for this is to be. And I'll tell you right now, as we know by experience, no matter how many people have gotten vaccinated so far, there's already a third wave on the rise, right? And the only way that's happened is because people brought their mask down. Now, I think what the WHO was referring to, Margaret, I'm going to be honest with you, was when we have hit herd immunity, then after the second vaccine, will we be able to say it's comfortably okay to not wear masks?
But
herd immunity.
Yeah, it's confusing. I would not even suggest saying that. I would just, put out there, it lowers risk. To be vaccinated lowers risk, but nothing is 100%.
And I know that the CDC and Health Canada here have been following the same thing, but I think what that was in reference to was after herd immunity, which means more than 80% of the population in general has been vaccinated. That's typically when we hit herd immunity, where we now protect essentially one another. Now, my biggest fear with that is that we're not going to hit herd immunity.
Yeah.
If we're looking at the statistics right now, how many people, and again, I'm going to say this to all of you that are in the room. I lived in the US. The US was my home, my second home, and you know this. Everywhere from North Carolina to New York, to Atlanta, to Ohio. I lived everywhere, and I sometimes miss it extremely. But I do know there was a high percentage of people in general, in a lot of the areas I used to live, that didn't believe in it. They don't believe in vaccines in general. And so that's the fight we're about to fight. That's what we're working against.
And people with religious restrictions too on vaccinations, right? What about, that population, right? Everyone isn't going to be vaccinated, right? And
Correct.
You can't mandate it, right?
Right. But you know what? If you look at the news, what I think breaks my heart the most is that Bill Gates was working so hard to help eradicate polio. And since COVID started, all the doctors that were going home to home in like Pakistan and like Saudi and areas that were underserved to eradicate, like completely get rid of polio ever, so that everyone would be vaccinated. They were going home to home and vaccinating everyone, had to stop because of COVID, and polio is back. So, there's a thing to be said that like there is proof that vaccines work. Again, I'm not here to tell people what they should do, but we do have to sometimes look at the statistics and look at the information. And what I mean by that is look at true information, not clickbait. There's a lot of headlines out there that I can tell you the minute I click on it, 4 ads pop up, buy figs, buy this. That already automatically tells you that the website is absolute garbage. And that's just one of the first red flags. And then when they have to use lots of big words, so most of the news stations, they're very politically driven, as we've already seen. You just need to know where to find the good research and ask people like Dr. Rogers. She can tell you where to look for that. Reach out to me. I'm happy to have these discussions because I am about providing proper information for you to make the best choices for you. And if you have children, the best choices for your children. Right. Because we all deserve that, at least.
Right. And absolutely. Again, just to say, this is Dr. Natasha Collia. She's out of Canada, Toronto, Canada, emergency room physician for children. And I have to ask this question before I go because I had this written down and it slipped my mind. So marginalized populations, right? When you talk about COVID and talk about the vaccines, can you talk a little bit about that with respect to the vaccines, being vaccinated, et cetera?
Are you talking about like their accessibility?
Yes.
Yeah. So I love that you brought that up because, one of my second episode of Physicians in Living Rooms on Instagram Live was actually, with a physician in Detroit who deals with patients with sickle cell disease. And he actually is a big advocate for marginalized groups, underserved areas, and racial disparities in general in medicine. And I am a big ally and advocate that I believe that these vaccinations should be, accessible to everyone. Everyone has the right to something that could be life-saving, life-preserving, and life-changing. And I think the problem is, and is that Shirlian? I hope I pronounced it right. Thank you. I appreciate your lovely comment. I'm glad it was helpful. But, this is exactly what I'm going to say, is that it ties into what, this comment is that one is information access. A lot of the marginalized groups sometimes don't have the access. They also don't have people advocating to provide them that information. So it's almost like they're out of the loop, or they do live far geographically. Right. They live far and don't have the accessibility, which is why you have doctors who like to work in underserved areas so they can be that vehicle for vaccines, be the vehicle for information, for support. And we don't have a lot of it, and it's unfortunate. And I think we need to recognize this, but I also think as a healthcare system, we can be better.
That's why I asked that question. That's why I asked that question. And I would encourage you all to check with community resources and see who's going to receive vaccinations, who's going to be approved to do vaccinations, because not every center is approved for vaccinations. But check your resources in your community, see who's going to be approved to give vaccinations. So
Tanya's comment, she just essentially said exactly what we were saying. You still need to use your tools. And Tanya, thank you for putting that up, because, I keep up to date with CDC and Health Canada work hand in hand together. And like I said, even if you have the vaccine, you're not spared of carrying the virus. The vaccine's goal is to minimize moderate to severe symptoms or death. So remember, you can get the vaccine, still carry the virus, still project it onto someone else. And until we do not have 2 vaccines each and reach herd immunity and know how to control these variants, which, by the way, the Pfizer vaccine apparently does better than the Moderna vaccine, but they're starting to learn more about the Moderna. The reality is this is just like all other viruses. We need to find that underlying cause of how it mutates, and every year it's going to be a new vaccine, and we just need to keep doing our part. And I love that, Tanya, you quoted CDC, because I've been saying this to all the parents that come in and see me and all my family members that are like, well, once I get it, should I be fine? And I'm like, no, you can still be a vehicle for someone else. So respect someone. I put it like this for everyone in the room. I always put it like this. You have the choice to vaccinate or not. You don't get the choice to put someone else's body and someone else's life at risk. So if you choose not to vaccinate, please understand that is your choice and we all respect it. But let's say I'm immunocompromised and you're going to decide to come near me and potentially infect me. I didn't have that right or choice to allow you to do that to me. Like, no one gave you that right. So you need to be conscientious of other people's lives as well. You can't just say, I don't want to vaccinate, but also I'm not going to follow any other rule and just go out and be careless.
Right.
Because that is truly what's happening. And I don't want to judge, but if you're putting my life at risk, and I'm talking on behalf of a sister whose brother has heart issues, a mother who has a weak heart, a fiance who has a weak heart, like my whole family is high risk. They didn't choose for your choice. Like, they didn't help you. Don't affect their lives if you choose not to vaccinate.
Excellently said. And I think, many of us, our families or ourselves are high risk, right? And we do our best to keep ourselves safe, whether we're in the home or outside. Many people stay in the home because they're afraid to go out because don't feel safe, especially elderly population and those at-risk populations. What about children? Did you mention if children can be vaccinated?
That's a great question. So right now, remember how I said that part of the research process is you always have to get pretty healthy people to enroll. What's unethical is to enroll children, right, at first, and pregnant women. They're just 2 groups and populations that are not allowed to be enrolled from the beginning.
Right.
Now, currently, I'm seeing a lot of positive stuff. I think the earliest right now that Pfizer's vaccine can be given is between the ages of 12 and 15. So the earliest is 12, but they're not. Remember, in general, the pediatric population is not as affected. Does that mean that they're not vehicles to pass on the virus? Sure they are. But they could be vehicles by passing on the virus without being affected or with the vaccine, no matter what. So we're trying to give it to people who will be more affected than children are. Okay, so children are unfortunately not the priority, but children are not the ones that are predominantly.
That's an excellent question, because they're about to return to school. So the anxiety is real about, should kids be vaccinated before they return to school, or how are we going to protect our kids and our teachers?
I'm going to pose the same question in return to any parent in this room. Just think about this when I'm talking to you. Every year when your child goes to school, do you worry if they're going to get rotavirus? Are you worried that they're going to get flu? Are you worried that they're going to get coronavirus, the general, the rhinovirus, the RSV? No, but then parents do come into the ER probably 8 times a season. And the reality is all of those viruses. So realize that I want you to understand that, sure, coronavirus is scary because it's so new. But if you need to be equally afraid, if you're going to be that afraid about coronavirus, equally afraid every time your child goes to school, because there's a chance that they're going to pick up things like the flu. That's a killer for kids, right? Kids, on average, every year, there's about over 56,000 children that usually get admitted and 19,000 deaths a year. Do you know how many deaths that we've seen this year from flu?
How many?
None that I know of. But look what happened. Social distancing, masks, hand washing, everything we tell parents every single year to do and be very good about it. What's happened is now we've seen a drop in flu, drop in respiratory illnesses that do kill children. That's the children population. I'm just saying that from a child. So there are some positives when I talk to parents about social distancing and masking.
Yeah.
So, you know, I just want people to be aware and conscientious about it's still important to mask and social distance
Yeah.
when you can, you know, and just don't be careless.
Yeah. Excellent. So, you know, we're going to wrap up, but just to reinforce, you know, when you become, if you decide to become vaccinated, you know, you still have to protect yourself. Mask up, wash your hands, hand sanitizers, you know, wear face shields if you can, if you would like. Again, the vaccine is up to you all. You don't have to be vaccinated. Nothing is 100%. It just lowers the risk of either contracting the coronavirus or passing it on to someone else. So protect yourselves. I appreciate you, my friend, Dr. Natasha Collia. Again, this was such an excellent opportunity to create this forum for you to come on and talk about this, because it's such an anxiety-provoking discussion, right? I think when you talk about corona in general, you know, you look out and you see these mass deaths, right? A lot of people are impacted by the coronavirus or have been impacted vicariously. You know, by just watching the news, they're impacted, right? Including myself. So to reduce anxiety a bit, I thought that we would come on and talk about the vaccine. And you know, you did such an excellent job. Any last questions before we end?
And I appreciate it. Like it's always a nice opportunity, no matter how many people you reach out to or how many people, you know,
Right.
People learn differently. People receive information differently. People process information differently. And sometimes, you know, it could take someone like Dr. Fauci to reach you, to explain to you, because he's so well renowned and he's so brilliant and he's been at the head of all of this. Or it takes someone as simple, and I consider myself simple, someone as simple as me to break it down in a different way. But as long as all of us are able to keep educating and reaching people to give you the best tools, the best information to make the right decision for you, not the right decision based on what I think. This is not what this is about. But making sure that your decisions are not, you know, clouded by garbage, clouded by conspiracy, clouded by political stuff. That's our goal. So I may not be Dr. Anthony Fauci, but I do know that sometimes education, it comes in so many different ways. And I learn from everyone I meet. I've learned from you, Dr. Rogers, and the times that we have chatted and met. I learn from all the people who come to my Instagram, parents I meet every day at work. You know, I'm a constant learner. I don't know everything. And I'm just as in the middle of all this as everyone else is, but I am open to discussion and open to hearing more and learning more.
Yeah, absolutely. Dr. Rogers, Dr. I would love to have you speak to the female groups that I am a part of in Miami. You should do this again. Absolutely.
I would love to.
Yeah, absolutely. You know, you can IM me information, or, you know, again, this is Dr. Collia. She does have an Instagram page.
Please reach out.
That's not your name Instagram, though.
No, it's Dr. Tash Official. There's only one, thankfully, till there's someone else, and then there's going to be another one.
Yes.
But please reach out to us. I, you know, the more I can reach out, I know that I have a busy month and a half coming up, but
she is always busy. In each emergency room physician, I can barely get in touch with her, so she is busy. You know, be careful. I do want to say be careful when you do your research. Again, when you do your Google searches and researches, because everything isn't factual, as we learned today in this forum, right? There's myths out there. There's misinformation. You know, I usually look at empirical stuff, you know, that research has been done on. You want to say anything about that before we leave? Because we just go and, we just gather so much information from the media, from the Google searches, everything's on there. So
I'll say this: I've met a lot of families. The Google searches have actually hurt their partners, their children, due to fears, COVID fears, due to misinformation. And again, I want, like I said, my mission is to teach parents and caregivers to be the best advocate for those that can advocate, and that includes yourself. be the best advocate for yourself.
Right.
And with that comes learning how to decipher what is good information. But also, I'm going to say this because I think this is a part that we don't talk about, is once you have that good information, how do you break down that information to understand it? Because what people tend to do is they like to throw lots of numbers at you, and we assume big number means good, depending on the sentence. Low number means bad, depending on the sentence, and vice versa. And it does take time. But I promise you, like, if you have the right people that you can listen to and the right people to talk to who know this, remember, I say this to my mom all the time. I'm going to leave it with a little nuance. I'm going to be honest. I don't do my own taxes. I don't know how to do taxes. I'm very honest about it. My mom is a tax expert. So who do I go to? I go to my mom. But when she tells me something about taxes, what she needs for me, how she needs me to do things, how to sign, what to sign, why she's doing it, I may ask questions, but I don't tell her she's wrong, and I don't come back to her, because what do? Everyone has a role in this world. We all play a different role. Dr. Leslie Rogers, you have your role, I have mine. And more disheartening than when someone comes to you when you're an expert in your role and then tells you that you don't know what you're talking about, and then tries to bring something like Holly Herbalist and Dr. Google and Dr. Wikipedia without realizing that 90% of these people have financial ties. They're getting money just to say things. They're politically being supported. And it's unfortunate. And again, I'm not on a political statement, but I want people to be careful, because I've seen children die. I've seen people hurt because bad medical decisions, or not allowing us to make proper medical decisions, were being restricted due to this kind of information. And, again, at the end of the day, it's people's choices to make their decisions, but make sure your decisions don't affect others either. You can choose to do what you want, but let it affect you. And I love and care for everyone that I don't even know, because that's just part of what we do. I want people to be safe, and I want people to be, careful. No regrets, right? No regrets at the end of the day.
Excellent. So again, this is Dr. Leslie Rogers, mental health professional. Next week, we're going to continue to end out the month with COVID awareness, and we're going to have a panel of students on to talk about how COVID has impacted them. And we're going to have a child clinician that specializes in children will be on next week on the 25th too. And that will end out this series of COVID Awareness Month. Okay. Thank you all for coming. Your questions were absolutely wonderful. Thank you again, Dr. Natasha Collia. And we will hopefully see you guys soon.
Thank you, everyone. Stay safe.
Mask up. Be safe.